Today I'm showing you a manual technique to release sacroiliac joint pain during pregnancy. But first, if you're pregnant and new to my channel, make sure you subscribe and click the notification bell below so you don't miss any of my future releases. SI joint pain is generally experienced as a stabbing pain in the joint right there, and it's often on one side more than the other. The reason why it is more common in pregnancy is because your body is looser from the relaxin hormone, which can make this joint unstable, or sometimes it can also get jammed or get stuck as a result of this instability. The first way and most effective way to do this is with the help of someone. Okay, so what we're going to do here is first identify where her sacrum is. So basically, if you take the top of her butt crack, that would be the lower end of the sacrum here, where the tailbone is. And if you identify the holes in the lower back, we're going to be able to find the top of our sacrum bone here, because those little depressions here are a good landmark for you to find where the top of the sacrum is. So for example, on her, the little dimples in the lower back are just right there. So I'm just going to mark them here with a marker. So you can picture that triangular bone, which is her sacrum, starts from here and goes all the way there. And our technique will involve putting our hand on the side that is painful. So for example, if she had right sacroiliac pain, we will want to apply pressure on the right side of the sacrum. So we're going to take our visual landmark here and we're going to apply the pressure with this side of the hand right here towards the floor, because she's going to be on all fours. So that's why I really like to identify those landmarks, because I think they're really helpful to put our hands at the right place. And we want to put our hand like not right in the middle, right? Because you can see here how there's like those bony points, and that can be really uncomfortable if you put your hand there. So we want to go right in that dip right here in between the little hole and the middle. So right there would be where we'd put our hand. If she had pain on the left, we'd put it on the left. So let's do it. Okay, so the technique will consist in putting our hand right inside of that dimple. So for example, if I wanted to do the technique on the right side, I would put my hand right here, so in between the middle and the dimple, and I would apply pressure with my other hand like this, straight towards the floor. Does that feel okay? Mm-hmm. Perfect. Some people might just put their one hand. I just feel like I can get more pressure if I apply my other hand on top. If that doesn't feel good for the person who's applying the technique, you can also use this side of your hand, and I kind of just go like this. And sometimes, is it more comfortable for you?
Both are good, actually.
Both are good, okay. Because sometimes, because you have more coverage, it can feel better that way. For as long as you stay on the sacrum. So what I see a lot with partners is that they go too high, so over the dimple, and that is not the sacrum anymore. Like the sacrum stops here, so you really want to be between the top of the butt crack and the dimple, so right there. If I wanted to do it on the left, I would go right here, and we want to keep that pressure for 30 seconds down towards the floor when we're doing it for pain relief. Of course, it should help reducing the pain. If the pain increases, that means it's not indicated. You should definitely stop it. Maybe you're not putting your hand at the right place, or maybe it's just not something that you should be doing at this moment. So of course, I always encourage people to consult with a pelvic health physio, a chiro, an osteopath when they experience pain, to make sure that this is really the cause of their pain is the sacroiliac joint and not something else. So basically, in terms of the pressure that you want to apply, I always like to compare it to putting a lid on a Ziploc container. So if I do a demo here for you, I'm just gonna kind of rest the lid on the Tupperware or the Ziploc container, and that would be about the pressure I put for the lid to secure. So that's about the pressure you want to put on the joint, or a little more, but definitely gauge on the pregnant person's feeling and how she tolerates the technique. Like I said, you don't want to increase pain, you want to reduce it. Now, once your joint is released and back into place, it's important to do some strengthening exercises to keep it stable. I will link my video about SI joint exercises in the description below if you want to take it a step further. Make sure you give this video a like if you found it helpful, and thanks for watching.